became friends with a few plastic surgeons, and one of them actually said, hey, why don't you come with me to an injectable training class? You can learn. I said, okay. I went, and that's where my skills were born. So I've been doing it for 16 years.
Basically, I've been here a few times. I'm getting Botox done on my forehead to actually take away the wrinkles, and I'm getting Juvederm done with one syringe just to take away the frown lines. I've been mistaken several times for being in my early 30s, late 20s. The reason I'm actually doing Botox, believe it or not, is because of my girlfriend. She's 20 years younger than me. She's a great person, and she had influenced me to try it, and I never did it before. I actually tried it. I liked it because it took away a lot of the stress lines. I also had stress lines in my face because of a lot of dealings that I went through over the years. And I noticed that my face smoothed it out when I used a Juvederm, which is basically like a sealant. You know, it basically plumps up the lines here, the frown lines, and it helps you get, a steady pace of your skin. I'm trying to explain what the Juvederm does. It makes skin more fuller, right? Thicker, stretches it, plumps it up.
Hi, Joe. Good to see you. It was a
Nice
pleasure
to
to
see
see
you.
you again. So you're back again for another touch-up?
Yes.
Okay.
Just a little on the forehead and maybe like a syringe on the cheek.
If you need some more, you can come back because you're close by, and then we'll just do the one syringe today of the Voluma.
Don't think I don't feel these things.
Yeah. Better?
Oh yeah,
Nice,
absolutely.
right?
Absolutely.
So no lying down for 3 hours, no rubbing your injection sites for 3 hours. I'm talking about the Botox, and don't work out until tomorrow.
Offer laser hair removal at Dolce Aesthetics. It's amazing not to have to worry about shaving anymore. People come to do all sorts of body parts. Our laser is one of the best. It's a Cynosure Elite. We tell people that it could take 8 to 12 sessions before they get to 90% hair reduction. It's not absolutely 100% removal, but it comes very close.
I'm getting laser hair removal treatment. So far, the results have been significant. I have no hair growth. This is my 4th treatment, and I think it's absolutely fantastic. It's painless, it's quick.
The hair that's treated on the day of the appointment actually sheds out 2 to 3 weeks from the appointment date.
I've been shaving forever, and I just got tired of it. And being a woman of color, I suffer from hyperpigmentation, and so far my results have been absolutely fantastic.
This is our lipo freeze machine. What this does is it sucks fat up, and it blows really cold air through the apparatus, so it freezes the fat, and then your body absorbs it and it excretes the fat. So what you do is you take this apparatus and you place it on the area of concern on the patient. This across the person's belly, or wherever you could suck fat. You could do it here, you could do it here, anywhere on the body that you could grab fat. You could do it here, you could do it on your love handle, your back fat, your under your arm fat. You could grab the fat and you place it on the area, the problem area, and what happens is this suction goes, sucks up the fat, and it fills up into this area, and it blows really, 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 really cold air through, like negative 11 degrees, and the fat dies. And when the fat dies, the fat gets excreted through the body, and we lose the fat. It's much better than using regular liposuction because there's no invasive procedures, there's no surgery. So we have a lot of patients who like to do this because we have a lot of fat patients. No, I shouldn't say. We have a lot of patients who like to do this because it helps them with their problem areas, which is mainly your abdomen, your love handles, and your back fat. This is our lipo freeze machine, so I think you should try it. Hi, Yara. How are you, darling?
Good.
I'm glad that you're here. Good to see you. How have you been?
Good, you?
I'm good. So we're finishing the rest?
Yes.
Okay.
Top is like a little bigger than the bottom, so I just want to make like I don't want the bottom. Yeah, I don't want it to be too big, but just like a little
bit bigger.
Yeah. I'm getting my lips done today by Jen. This is probably like my 3rd time here. She's amazing. So I've tried the Ultra and the regular Juvederm, and I feel like the Ultra is better because it does last longer, and I just feel like it makes the lips look way better than the regular Juvederm.
So we mold the lips because when we inject the Juvederm, it's like depositing little drops of the hyaluronic acid, so you have to mold it. It's like sculpting clay. When you have any kind of trauma to the lip, okay, usually what will happen is you will swell, you will bleed, you've got some bruising. So sometimes if right after the procedure, because you still have a puncture wound that's kind of still open, if something enters it that's spicy or something like you're eating like hot sauce or buffalo wings, it can cause it to enter the puncture wounds and can cause excessive swelling. And it has happened to a few of my clients. I had a client leave my office and eat hot wings right after. She didn't even feel her lips because she had numbing cream on, didn't realize how swollen her lips were, and her lips were like exploded.
Yes, y'all. You don't stop. Keep on.
Hi, my name is Catherine Stornello. I'm getting the Kybella treatment. I've done it one other time before and it worked a little bit. It takes more than one time. What it does is it kills your stubborn fat underneath your chin, and I have numbing cream on right now. I'm prepping for my 2nd procedure.
Hello, darling. How are you? Are you ready for your 2nd treatment today?
Yes.
Are you excited?
Yes.
Okay, great. Did you swell up last time a lot?
I did.
So what she's doing today is Kybella, and this is the treatment of the double chin. And it's really the real drug name of it is called deoxycholine. It's been around for a very long time, but Allergan, the mothership, has FDA approved it for underneath the chin for the double chin fat, and it works really well and it's permanent. But you have to do multiple treatments. It's not one and done, so sometimes patients get a little frustrated because they don't see as much of a result as they want. But by the 2nd and 3rd treatment, even if they have to do 4, they're gonna really see it. And I did 4 treatments myself. This is since my 3rd treatment, I see it still working after like 3 months. Like I see it's getting smaller and smaller and smaller. So now I only have to do 1. I started out with 3. I have to do just 1 more vial, I think, for the double check. So what I'm doing right now is we're gritting her because there's certain structures that we cannot hit. So we have to be very careful where we are and where we place the deoxycholine. So right now, so this is like a temporary tattoo. So basically where we see the dots is where we're going to inject. Okay? So this is her 2nd treatment. This is going to be her 2nd treatment. She's doing a little bit more this time. She did 2 vials last time. So this is lidocaine, and we're going to numb the area. You know, you feel very numb in the area. You get swollen in the area. It feels really weird. It feels like it's like a weird feeling more than anything else, right? When you touch it, it's like a weird numbness.
Yeah, I can't explain it. It's a strange feeling.
It's a very strange feeling.
Yeah.
So there's like an area, there's like a nerve called the masseter nerve, so you have to be very careful of it right here. So that's why we grid the area, because there's structures all over that you don't want to disrupt. And also the thyroid, which is right here, so you have to be careful. Great. Great. How do you feel? Does it feel weird? Burning?
No, that's what I'm waiting for.
It's gonna start. Doing great. Burning? Okay. Means it's working, sister. We want that. When I did it without numbing, with the lidocaine, I felt ringing in my ears.
Really?
It was bad.
Oh, what, you did it without it?
Yeah, I did it without the numbing. It was horrible.
Oh.
I felt like my ears were ringing. It was burning. It was so painful without the lidocaine. It starts to
It's
burn
just
more.
like a weird, like, burning sensation.
Yeah, fat is dying because it kills the fat on contact. So we're gonna put some ice. You're gonna sit here for a minute with the ice. You did great. You did really good. And I'll see you in 2 weeks.
Hi, my name is Vito. I've been coming here for the last 5 years. I'm all the way from Alaska. The reason I come see her because I trust her. I've known her since childhood, but she had a crush on me. And I recommend everybody come here. My face was all wrinkled up and she got through with her. Now look at my face and coming here for another treatment.
Hi, Vito.
Hi.
Oh, Vito. Oh, my first crush. How are you?
Good.
Good to see you. So, Vito, what are we doing today to this gorgeous face?
Well, it's gorgeous. You made it gorgeous. 5 years ago, it wasn't so gorgeous, so.
So, would you want to do some Botox?
Yes, Botox will be great.
So, the forehead, anything around the eyes?
Yes.
Okay. How much have you done in the past?
Well, when I'm coming to see you for the last 5 years, what did you give me? Just a little bit, just to keep me going.
So, I want to do about like 40 units. I think that's a good dosage for you.
Yes.
So let's beautify Vito. This is my unorganized mess. I don't think Vito really knew that I had a crush on him, but whenever my sister lived upstairs from Vito, so there was a back staircase that used to lead from their house to our apartment, to my sister's apartment, and every time I knew Vito was home, I'd be like, oh, Vito's home, I'm going down the stairs. And I used to go down and sit by their kitchen and see if Vito was hanging out so I could have a chance just to talk to him. Give me a frown. But I don't think Vito lost his Brooklyn accent. I still hear it.
It comes out.
Does it come out more when you get mad?
Not when I come in, yeah.
Do you wear sunglasses all the time?
No,
You have to start.
I don't really wear sunglasses.
That's why you're getting these crow's feet.
Why? Because
Because you're squinting.
I squint a lot?
Yeah, you're squinting a lot. Let me just give you a little bit more on the other side. Okay, Vito, you're all done.
Didn't take that long to make me look good.
You did great. Another
She's gonna
happy-
marry me down the road, so she wants me to look good.
So we're doing a chemical peel on Shannon. Okay. We actually just already applied the glycolic acid, and this is the third part of the peel, which is putting on the retinol complex. How does it feel, Shannon? Does it hurt? No, not at all. It usually takes about 15-20 minutes to do the peel. There's 5 steps. The first is cleansing the face. Second is applying the glycolic acid. Third part of it is you're gonna nourish, so you're gonna take off all the glycolic acid off the face. And then the fourth part is putting retinol complex on, which also helps rejuvenate. It helps the skin, it helps acne scarring. And then the last part is we're gonna take the retinol off, and then we're just gonna put some moisturizer on. And she should start peeling in about 3 or 4 days.
Coming to Jen for almost 2 months. I did chemical peel like 2 weeks ago, and she recommended that after chemical peel I follow with microdermabrasion. Keep it coming up, keep it coming.
a microdermabrasion where it's going to take off all the excess skin that we have on the face after the peel, and it's going to look fantastic.
That would be my second set of that treatment.
You ready?
I did it once. I know it's
You're excited?
Yeah. I was so happy with the results. I'm going on vacation November 7th to Bora Bora, so I want my face to be glowing.
So this is part 2 of the treatment that we're going to do. We did the peel first, so now we do a microderm a week later because it helps get rid of all the excess skin that came off with the peel. Okay?
So I'm using the microdermabrasion, and I'm just hoping for the best results, but so far I have been very, very happy.
We'll just use it's a prep solution to just clean her face off. We don't like to use soap because it makes the skin too oily. So we use there's a little bit of acetone in it. And what it does is it takes off all whatever she has on her face, whatever dirt, oils, creams. We have a lot of skin still coming off.
Oh yeah?
Yeah, so I'm gonna get off with this.
I was under the impression that the process has stopped.
Yeah, it's still coming off. What this does is it also helps, like as the chemical peel does, it helps with the melasma, it helps with hyperpigmentation, it helps with acne scarring.
Turn me down and just close your door. Don't stop me now. Ooh, keep it coming, love. Oh yeah.
It just suctions the old skin up. So there's crystals in the pen, and what it does is it just breaks up, like I said, the acne scarring, the hyperpigmentation, skin. So we just do 2 passes. See all the dead skin that came off? That's all the dead skin that just came off. Sunscreen / moisturizer. And she's good, and she's gonna come back in 3 weeks and do another 2 weeks and do another peel. Correct? Mm-hmm. And that's it. And then just wait another 2 or 3 weeks and do another peel. Looks great.
I had a lot of that skin in here. I could see in the mirror.
Yeah, I got a lot of it off.
Yep.
Yeah, a lot of it came off. Looks great.
Thank you.
You're welcome. Another happy patient at Dolce. Hyaluronic acid is like a magnet for water and collagen. So sometimes when you first start doing them, that happens and it kind of pulls in one spot. You can always just knead it out and just smooth it out. It just pulls. Sometimes it happens when the fluid and the collagen come down because it's like a magnet.
My bottom lip bigger than my top.
Okay.
Like I want both bigger, but my bottom I want it to be bigger than the top.
Okay. You have about a little less than a half of a syringe, like a 0.4.
And I want to keep the Cupid's bow. I really
Yeah,
like
no,
that.
your Cupid's bow is beautiful. Oh, so many people want to get rid of it. I'm like, why? People come in and they're like, I want my lips to look like this. Not everybody, like Kylie Jenner, not everybody can look good with lips like her. They don't have the shape for it. Their lips are longer. You know, her lips are very like yours. They're like a heart shape, so they're very centered in the face. They're like rounder. Some people have longer, wider smiles, and they just don't look right. They don't want a Cupid's bow, and some people that doesn't look right. If they have a Cupid's bow and you try to get rid of it, it looks weird.
I just really do like the pouty look, like that.
Well, yeah, your lips have that look, the pout. Like my lips are a powder look, so it's just we have that pout. Some people don't. You know, you just have it naturally, so this is just an enhancement to your natural pout. Those look so pretty. keyhole pad. So this is a look that you get a little dip in the center, so it looks like a keyhole. Did you drink?
Yeah.
Yeah. You're gonna get this is bruised here. So we're just gonna have to put a lot of ice on this, babe, okay?
Are you ever gonna stay with the big?
No. It's just swollen and it'll go down. You just have to, put ice on it. These are the things that cause this. Tylenol, Motrin, Aleve, alcohol, fish oil, vitamin E, ginkgo. A lot of natural things cause, bruising and inflammation. Can you come back in a week? I want to take a look. All right?
Joseph Uulati, and I'm getting tear trough dermal fillers today.
Hi, how are you? I'm Jennifer Delangelo. Nice to meet you. How's everything? Great. Welcome to Dolce.
Thank you.
What brings you in today?
For the tear trough is underneath the eye, the line that goes between the nose and the eye, and I'm getting fillers so that the line is less prominent.
I love doing tear troughs. It's one of my favorite things to do and correct.
From what I researched, it lasts anywhere between 6 months to a year.
A lot of people fail at doing tear troughs because they put in filler that's too thick. So what happens is there's a membrane right here. And since we have our sinuses here and here, everything sort of, and our eyes, drain to this membrane. So as it's passing through, when you have filler here, the filler gets bulkier and you wind up with bags. So if it's a heavier filler, it's gonna hold and retain more water and cause a problem. So whereas Bellatera won't, because it's a thin filler.
This will be my first time. I'll gauge to see how effective it is and how long it lasts, and then I'll see if I come back in the future.
You might bruise. I'm gonna tell you, expect the worst and hope for the best. So I tell my patients, expect that you're gonna bruise, and if you don't, then it's all the better. You might have some swelling. It might last a couple of days, could last a week. Ice is the biggest key. So you'll have that on all day today. Keep it on so it reduces the swelling. Do you take a lot of herbal supplements or protein shakes and things like that? Okay. So that might cause more bruising because of that.
What were the exact chances you would say of bruising to happen?
Other factors that it's going to increase the chances. Like I said, with you might increase it a little bit because of the protein and maybe the supplements you take. It might cause more of a apt to bruise. So you're really good hands. We have been doing this for a long, long time. I'm the Picasso of the Botox and the filler world. I am. So what we're doing today on Joseph is we're treating tear troughs. A lot of people have this issue. As he gets older, if he doesn't take care of it now, it could get progressively worse.
Sweet surprises, happiness. You fill my heart desire more and more.
So we're gonna give you some arnica pills to take. Arnica montana is a natural homeopathic medication. It comes in a pill form and it comes in a gel or a cream form. And what it's used for is to help bruising and inflammation. So it also helps pain. So I often give it to my patients to help them recover with any procedures that they have done.
Okay.
Better?
Yeah.
Okay.
Never sad. Things don't bother you like dudes don't survive.
Looks a lot better. Looks really good. Another happy patient.
Hi, my name is Miza. I'm one of the nurses nurses doing an IV therapy procedure today. The reason why we do IV therapy is because it's more effective than taking medications by mouth. What happens when you take medications by mouth is that it goes into the stomach and the gastric juices are so acidic that what happens is they absorb too much of the nutrients of what you're trying to take, as opposed to IV therapy, which goes directly into your vein. So IV therapy is actually more effective. We mix it with a cocktail of vitamin B, vitamin C, magnesium, all other electrolytes, and we can tweak it to however you need it. If you have fatigue, we can add an extra vitamin B12. If you have chronic pain, we can add a medication called Toradol. If you have any stomach upset, we can add a medication called Pepcid. It's great for anti-inflammation, for people who have issues with pain. IV therapy is going to be something that I feel a lot of people are going to benefit from. I've done it myself personally and I get great results from it.
Today I'm going to get a hangover cure, and this is our beautiful IV nurse that's going to explain to you.
She is going to get a hangover cure. This IV has many vitamins, vitamin B complex, vitamin B12, B6, vitamin C. So it's going to help you to hydrate your body. It's going to help with immunity. It's going to help with getting ready to sleep at night. She won't feel as tired tomorrow when she wakes up. I've done it personally and I totally love it. I swear by it. Okay, so next step with IV therapy is the preparation of the IV bag. So what we do is we use a 3 ml syringe and we draw up 1 ml of each vitamin or mineral, whatever it may be, vitamin C, vitamin B12, B complex, magnesium. We'll put them together in a bag, shake it up, and the bag is ready for IV therapy. So the next step for our IV therapy is the insertion of the IV and the connection of the IV bag. What we do first is we clean the skin, prepare the skin with an alcohol, we apply a tourniquet, insert the IV into the arm wherever the person feels more comfortable. After that, we flush the IV to make sure that it's in the vein. We secure the IV with a tegaderm or a tape, and after we start running the IV bag.
So I'm gonna feel like $1 million in 10 minutes.
You may also taste a little metallic taste.
From the magnesium and the vitamin E?
Yeah, and the vitamin B.
Vitamin B.
B12, yes. Some of the vitamins that we have in the IV therapy include vitamin C, which we all know is for boosting of immunity. We have vitamin B complex, B12, B6, and what that does is that actually gives the person a sense of vitality because they're regenerating the red blood cells. We have magnesium, which is what we call a vasodilator, which means that it dilates the blood vessels, so blood flow can travel better throughout your body. And we also have Toradol, which is an anti-inflammatory medication, so anybody who's suffering from chronic pain or inflammation, any other type of inflammation, Toradol will help with that also. Do you feel hot and tingly?
I'm always hot and tingly, baby. I'm always hot and tingly. I taste it.
So some people, when they're getting IV therapy, will experience a metallic taste in the mouth, or some people explain it, describe it as more of a vitamin-y type of taste, which is totally normal. That actually comes from the opening of the vessels from the magnesium and the addition of the B12 injection. So one of the things that people ask with IV therapy is, how will I feel this effect? Will it be immediate? Will it take a long time? Most people are not going to feel a super energetic feeling right after IV therapy. However, you will feel less tired. So for example, when your day is jam-packed and you have a 9-to-5 day, usually by the time 5 o'clock hits, you're like so tired. But instead of feeling that fatigue, you'll just kind of feel like, hey, I have a little bit more energy.
I'm the happy patient at Dolce! Woohoo! So I'm the happy patient today. Yes!